Hello everyone, I'm Dr. Archie Khera. I specialize in the field of conservative dentistry and endodontics. So today I'll be discussing with you regarding one of the most ignored topics of endodontics, that is the cracked tooth. So there are many a times when a patient comes to us and says that they have pain and they have discomfort, but we are unable to recognize what's the problem. So when we see the x-ray, we don't see anything. When we see the patient's tooth clinically, again we cannot find anything, but that does not mean that there is no problem. So we tend to ignore that there might be a crack in the tooth. So this is not going to be a long lecture, it's just a small video where I have actually put certain good flow charts that I found in certain articles, just to understand the basic concepts behind how to clinically analyze such a case, and along with that how to manage it. So the articles that I've referred here is by Sir P.V. Abbott, by S. Banerjee, and by W. Keller. So according to the American Association of Endodontists, the classification of cracked teeth, as we all know, includes a craze line, a fractured cusp, a cracked tooth, a split tooth, and vertical root fracture. They can have varied symptoms. Like if the patient comes with a craze line, generally they will not have any kind of discomfort, only you will be able to see it. So the prognosis for such cases will be excellent. Then if there is a fractured cusp, the patient will have mild or general discomfort and only to biting and cold, and the pulpal status will usually be vital. The prognosis in such cases is good. If there is a cracked tooth, then the patient will have acute pain on biting and occasionally sharp pain to cold. The pulpal status in such cases can be variable, that is, it can be vital, it can be non-vital. So we have to see with our pulp sensibility test. And the prognosis for such cases is questionable. So it depends on the depth and extent of the crack. Now, when we see a split tooth, there will be marked pain on chewing, and split tooth and vertically root fractured tooth are mostly root canal treated. So they will have poor prognosis unless the crack terminates just subgingivally in the cases of split tooth. And when we see vertical root fracture, there will be vague pain. It will mimic the periodontal diseases, and the pulp status is mainly root canal filled, as I already told you, and the prognosis is poor for single rooted teeth, whereas for multi-rooted teeth we can go ahead with root resection after seeing the bone levels. Now when a patient comes to you with a vertical root fracture, they will have different symptoms. They can have an isolated narrow pocket, they can have sinus tract, they can have multiple sinus tract, and you have variety of radiographic features as well. That is an entirely different topic. So I'll be going ahead with the cracked tooth. Now, just a moment. Right. So here what we see is, this is a really good flow chart that I found by Sir P.V. Abbott. And now what they have done is they've shown that a cracked tooth, they can have a reversible pulpitis or irreversible pulpitis. So the first thing that you do is you see the patient and the patient's symptoms, perform the pulp sensibility tests, that is your electric pulp testing or cold test or heat test. And then after that, if there is a restoration, please remove the restoration and the crack, analyze the cracks. And followed by that, if it's a reversible pulpitis, you can see here that you can give a sedative lining or a temporary restoration and just secure the tooth with a stainless steel band. You have to reassess those cases for certain days or weeks, and after the symptoms resolve, you have to review the patient after 3 months. Again, perform the pulp tests and then see if the pulp has a response or it does not have a response. Now, if we go to the cases of irreversible pulpitis, you have to again remove the restoration and the cracks and then see if the root is involved, then it has to go for extraction. If the pulp is exposed, then you have to commence your root canal treatment. And if a post or crown is needed, that you can see later according to the crown structure that is available to us. Now, again, after you commence the root canal treatment, one most important thing is kindly do not complete the root canal treatment. You have to perform till your cleaning shaping level and then place a temporary restoration followed by a stainless steel band. Reassess the same for 6 to 8 weeks. Now, if the symptoms continue, then it's an indication that there might be root involvement, so it has to go for extraction. Now, if the symptoms resolve, then complete the root canal filling and give a post and the full crown, whichever is indicated in that particular case. However, we all have to remember that such teeth have to be followed up for up to 3 years. Now, this is another detailed guide to diagnosis and management of cracked teeth. Now, first of all, it's listen to the patient, understand what the patient is trying to say, whether they ate something hard, when the pain is sharp and localized, whether it is there at night, whether it is there on biting or releasing, and then perform your pulp sensibility tests. And then look with illumination and magnification. See, fracture lines are not that easily visible. So we have to inspect it with probe and perform the transillumination test. And then check for tooth wear, check the occlusal contacts, and make sure that you disocclude the tooth when the patient is having pain. And the restorations, if there are, remove them and then look for fractures. Now, the tests that are performed involves the cold test, the bite test, and there is another test that Sir S. Banerjee have put in their article, that is the DCS, that is your direct supracoronal restorations. Now, in that, what they do is they make sure that it is slightly at a higher level and they do not bond the composite restoration, and they just see whether the patient is having pain on biting or not. So that is basically at a later stage. Now, when we see the diagnosis of cracked tooth syndrome, make sure you exclude the periodontal and periapical causes, any sorts of galvanic action, trigeminal neuralgia, facial pain, exposed dentin, and any sort of post-operative pain after root canal treatment. And you also have to exclude the apical pathology. Now, the most important thing is immediate protection. We need to give immediate protection for such teeth. If you do not give, the fracture line is going to progress, and if the prognosis initially is favorable, later on it will become unfavorable. So assess the pulpal status and accordingly we can give immediate protection. So if you're going to start with the root canal treatment, in the same appointment, you make sure you secure it with an orthodontic band, stainless steel band, and then you start with the root canal treatment after releasing the bite. So if there is a deep subgingival fracture and it's unrestorable, then naturally the prognosis is hopeless. And otherwise, we have to go for a root canal treatment. If it is successful, you have to see it up to 6 weeks, and then that means we can go ahead with the crown. And if it is unsuccessful, then the tooth will go for extraction. Now, for long-term management, again, if the case is of reversible pulpitis, you have not done a root canal treatment, then you protect it with occlusal coverage, monitor the pulpal status, and monitor the tooth wear. Now, this is a summary of some commonly used acute splints for the management of cracked tooth syndrome in general practice. Now, one of the most important methods is copper rings or stainless steel orthodontic bands that I've already mentioned. They are quite effective, economical, and they're minimally invasive. And the best part is that if you have to do a root canal treatment, in these cases, they are not going to interfere in your existing occlusal scheme. But you have to remember that you have to keep them for 2 to 4 weeks. And the other advantages include that it can be adapted circumferentially. But the only problem is it is not always at the disposal of a general dental practitioner, and placement may be uncomfortable for the patient. So you have to ask them to maintain the oral hygiene as well, because there might be certain amount of food trapping. Now we go on to provisional crowns or overlays, so they can provide an effective means of immobilization. Most general practitioners will be confident in these. The only problem is that it is time consuming to prepare, and undue delays, as I've already said, can make your favorable tooth prognosis into an unfavorable tooth prognosis. So another disadvantage includes biologically invasive, and there is a risk of pulp tissue trauma. So better if you can place an orthodontic band. However, you have to analyze according to the kind of case that you have. So That's it for today. I hope you got certain basic insights if you get a case of a cracked tooth syndrome. And I hope you all have a great day. I'll see you in my next video. Thank you.